Thank you so much for being here, Bryn. I'm so excited that you're here and that we get to sit across from each other virtually. I would love it if you would introduce yourself and tell us a little bit about yourself.
Yeah, thank you so much for having me. It's so fun to hear your voice and talk to you because I just love you. I'm Bryn, and I am a mom and a speech pathologist, although I'm not working right now due to chronic illness. I have lifelong neurological Lyme disease, and my two children were also subsequently born with congenital Lyme disease, which crossed over while I was pregnant with them. And right now I'm, just trying to find my way through life like everybody is, but with the added challenges of a disease that is really poorly understood, isn't covered by insurance, and just trying to fake it through life.
I really appreciate you talking and being so open about your chronic illness. And I know that that's one of the reasons that I love following you on your social media account, which you can also mention.
Oh, yes. I'm Bryn Barrett on Instagram. Yes.
And that's how we know each other. We met.
Yeah.
Instagram. And I know that I've learned a lot about chronic illness and sort of the realities of living with it, I feel like, from an outsider's perspective, of course, through your account, because you marry sort of humor and the reality of your experience so beautifully. And so maybe we could talk a little bit about, like, what motivated you to start the account? Go from there.
I really am isolated. Even before the pandemic, I felt isolated because my health is very unpredictable. And I had some really life-threatening complications a couple of years ago where I had swelling in my brain and I couldn't walk or move or talk. And so I had to quit my job, and I just felt like the whole world was going on without me. And I didn't have really any close friends with debilitating chronic illness who could understand like what it is like to be stabbed with needles every day and to never know whether you're going to be able to function, each day. And so this account, it gave me this feeling of like there was this community out there and other people. I just didn't know them personally. And it gave me an outlet to reach out and to make friends. And, also I saw you were probably the biggest inspiration for me, because there were a lot of years where you were struggling with postpartum depression and anxiety. And I was struggling with both the postpartum anxiety, but also feeling similar feelings. I felt feelings of loss and frustration, and just like the earth had crumbled around my feet. And to hear someone else's voice say how they really felt, it was just like oxygen to me, in a time where everyone around me was perfect and fine and everything was good. I needed to hear that voice. And so I just felt like I had this urge to go find my people, find a community of people. And I never wanted to solely talk about my Lyme disease, not because there's anything wrong with, being a really niched account, but mainly because it's just a part of me. And humor is really how I cope with things. I have such dark humor. Like my family and I, we can laugh about the worst things ever because that's how we deal with it. And so I wanted to have that be a part of it, but I also just wanted to use that in a way to reach like the general masses. And if I can reel people in with my humor and also sneak in little tidbits of education of like, look, this is what your friends and family are going through. This is what it's like for us, sort of normalizing it is my main goal of just bringing a general awareness, but also like reaching out and letting other women who are going through this too feel like they have someone who gets them.
I love that. And thank you so much for what you had to say about my account. And that's so the same motivation. Do you know what I mean? So I really I feel like we're definitely on the same page about that. It's like I want to feel less alone, and I want other people to feel less alone, right? And
Yeah,
that's the
yeah.
beauty of what social media can do, right? Um, so what would you say that people most misunderstand about chronic illness?
I think the number one is that it is usually invisible. I think most people in my life will see me when I put makeup on and I dress cute and I'm happy and I'm smiling and I'm able to talk about the weather and do my thing. They might not realize that inside my internal dialogue is screaming at me in pain and agony and symptoms of feeling overwhelmed, and just that it's not always what it appears. And a lot of us, I think the biggest issue most people with chronic illness have with their close friends and family is that they don't understand how bad it is, because we have to put a brave face on. We can't get through the day acting the way we feel. Like, that would go nowhere really fast. And it doesn't benefit my children to know that I'm having a bad day. You know, it doesn't benefit my husband, who has to go deal with his work and his life and not worry about me, to know I'm having a bad day. And so just to, if someone opens up with you about having a chronic illness, to really ask questions and don't assume, you know, ask them how they're feeling. Don't tell them, oh, I'm so glad you're better because you were here, or I'm so glad you're better, I saw you were at this concert, or whatever. You know, I had my mother-in-law say to me once, I was hooked up to IVs every day, and I had just barely gotten through grad school, and I was very, very ill because of it. And I went to my best friend's house down in Southern California. I went to a concert, and then the other, 36 hours that I was at her house, I was in bed hooked up to an IV. But I did go to a concert, and my mother-in-law saw it on Facebook and said, well, she must not be feeling that bad. And there's so many times people have made comments like that it's really damaging to the person you love with the chronic illness to feel like they're not believed because they're being brave. Nobody wants us to whine and cry and talk about how we feel all the time. But then when we act socially acceptable, we're also not believed. So it's just very difficult position to be in.
A feeling of being constantly misunderstood and also like surveilled, right?
Yes. Totally.
So what else would you like to say about what else do you want people to know about what life with chronic illness is like?
I think, I would love for people to know that the battle, specifically, if you don't mind me focusing in on what I deal with most, which is lifelong Lyme disease, the battle that we are fighting is not just in our bodies. We are battling the government, the NIH, the CDC, insurance companies, major policy changes that need to happen in order for us to stop dying. And it's so frustrating when you see so many people say chronic Lyme isn't real. And it's like, okay, well, if all of the data from the last 20 years is saying that it is, and we have a huge community of support and lots of doctors, but if anyone ever feels like, contacting me about ways that they can help it become better known and to advocate for your friends and family who are sick, don't just say, oh, I'm so sorry. That really sucks that insurance won't do anything. But it truly took me 5 minutes to write my representative in the House about a bill that's in process. It's called the Tay-Hagen-Tick Act. Sorry, Hagen-Tick Act. Sorry, brain fog. And, just little things like that. If you really love someone who's ill, that's like life-changing. To have someone who really supports you and doesn't mind taking the time to say so, not just the love and prayers on, a comment, would be amazing. And then I also think that it's important to remember that these people are living and growing up with the goalpost just constantly so far out of reach. You know, it's hard to have children who are chronically ill after I grew up chronically ill. And I really never in my wildest dreams thought that my kids would get it. I was in remission for a few years before I got pregnant, and watching them grow up with illness is so much worse than me having an illness. And, you know, I think to just be patient, because there are autoimmune diseases and chronic illnesses are on the rise, and it's becoming so common for kids to deal with. And, you know, just to talk to your kids about that too, about there are people with illness, it's not weird, and try to normalize that at home and keep that in mind. Anytime you're dealing with someone, you might not know what they're really, you know, dealing with, I guess.
What about telling us just like, what is Lyme disease? Like,
Yeah. So Lyme is an intercellular bacteria, and it is in the shape of a spiral. It is called a spirochete. There are other bacteria that are spirochetes. Syphilis is one, there's others. But intracellular bacteria have the ability to go inside a cell and go into any type of cell in the body. When you get, you know, a bacterial infection in a specific part of your body, like say you get a sinus infection, right? That sinus infection isn't going to cause renal failure. That sinus infection is not going to cause myocarditis or swelling in your brain, but it's a bacterial infection, but it's intracellular instead of intercellular bacteria. And so with Lyme disease, when you have an infection that can go in any part of your body, any system, and it's really, really good at hiding, people with Lyme often have a myriad of other diagnoses and diseases because of having these spirochetes do damage. I have so many diagnoses because of this. Like I have problems with my bladder. I've had problems with my spleen. I have inflammation in my heart and an arrhythmia. I have a syndrome called POTS, which is posterior orthostatic tachycardia syndrome, where there's all kinds of things that happen in my brain and in my blood pressure that affect me throughout the day. So Lyme is really, really quite scary. The number one cause of death with people with Lyme disease is suicide. The number two cause of death is Lyme carditis, which I have, but am managing, and luckily I'm doing much better now than I used to be. It's not nearly as bad as it was because I did really aggressive IV treatment and kind of got a handle on things. But it can be a real mimicker. There are lots of people who get diagnosed with MS, or they get diagnosed with Parkinson's, or a host of other things. Fibromyalgia is one. I have so many friends who are diagnosed with fibromyalgia, and then 15 years later, you know, finally get around to paying for a good, accurate test, and turns out they had Lyme disease. It's called the great imitator because it can look like just about anything. And I really want to urge people, if they ever are bitten or they ever are struggling with really mysterious illness, to seek out a Lyme literate doctor. And this is really important, is that not just any general practitioner is educated in Lyme. In medical school, they get about 5 minutes tops. And it's really, really old data from the 60s and 70s that they're being taught. Even though amazing universities like Columbia and others have started these whole Lyme research wings in med school, they're just not equipping people for this pandemic, especially where you live and in the East Coast. I mean, it is truly a pandemic. And so it's frustrating. You have to go to a specialist and, you know, get adequate testing, which costs like $300 to $500, and that's not easy to fork over. But the regular test that people are ordered in the US, and I believe Canada too, the test that if you go to a doctor, the one that they'll order you has a 55% false negative rate. So you just can't, trust that, oh no, they said I don't have Lyme. And I do feel I have so much sympathy for people who are walking into this world, because I've been doing this since I was 5. So I get it. I understand it. And when I have friends who reach out, or someone who gets sick or is bitten, it is really overwhelming. And it's hard when you have your general practitioner telling you one thing, the ER doc telling you one thing, and then all these crazy people online telling you another thing. And it's overwhelming. But just my best advice is to stick it out and really just try to educate yourself. And I do think that to a degree, Facebook groups can be helpful with finding maybe a reputable doctor in your area, and then listen to that doctor and who's a Lyme specialist, and go from there.
So what else do you want the world to know about you? Tell me that.
Gosh, it's so hard. I don't know why. I started a page that's like all about me and my journey, and for some reason it is so hard to talk about me. Do you know what I'm saying?
I do know exactly what you're saying. Yeah.
I would love the world to know that I get it. I would love people who are in pain and hurting, people who have trauma that is unhealed, people who are afraid to even tell the people close to them what is really going on in their life, because it sounds like a tragic melody from Greece. It is just so I want those people to know that they are not alone. And I really want to feel I want those people to feel less afraid, that this is a really, really scary disease. And if you don't have Lyme, there are lots of other really scary diseases. And just taking it one day at a time, finding a way to be happy when you don't have a lot of choices over your life. I don't have a lot of choice about working right now. I don't have a lot of choices about a lot of things. So I am finding choices I can make, and I'm, digging into those. And I just hope that everyone who sees this just takes that step to maybe go find their people, or find, someone they can relate to in a tough time, the way that I found you. And your posts meant so much to me. Don't let the only voices you hear, sorry, dog visiting, don't let the only voices you hear be the ones telling you, oh, you must not be that sick.
That's such a beautiful message. And I have one more question for you. Yes. And that is, what's your best advice for moms?
For moms, my best advice is, do not be a martyr. Do not for 1 second feel guilty for putting yourself first. It is so impossible to really get this across to young moms, because there's so much programming on, I'm going to be a good mom, I'm going to do everything right. And there is no right. And these children who are such beautiful and amazing gifts completely shatter your existence at the same time. And just to remember, it's okay to feel that way. And whatever battles you're feeling, it is okay. I would say just put yourself first, take care of yourself. I hate the analogy of the oxygen mask, but it's so true. I need to come up with a better one. That's my best advice.
It's wonderful. And I appreciate it. And I appreciate you. Thank you for taking this time.
I appreciate you so much. Thank you for just everything you give the world and us. I just feel so lucky to have your friendship, and you're the best.
Ditto. Thank you for doing everything.
Yeah.
Thank you. Okay, bye.
Bye.